I suppose patients are primarily valuing getting free of pain, improving their function, meaning that they can do things that they want to do, that they like, improving their working ability.
I think the value for the patient is like that way. You can think that we have good evaluation and examination, and based on best knowledge, best evidence, what we can find.
The value I see in DBC, I think quite simply comes from it's an approach that works for people. When people have pain and restrictions that don't allow them to move and enjoy their daily activities, I see the change in ideally the decrease in pain, but more importantly their increased mobility and their increased ability to move, to carry on with their daily lives.
We are building the treatment plan based on baseline assessments, questionnaires, physical measurements, design the treatment plan according to individual needs, providing the active therapy, providing proper advice how to deal with the problem, how to cope with it, and then documenting the outcomes and advising what to do after the structured treatment period.
There's no surprises for the patient, which allows you to progress them appropriately, whether that be aggressively or not. And if you're dealing with patients in pain, sometimes you need to be careful, sometimes you need to be slow, sometimes you need to control all the parameters, and having a process where you can systematically work through that will benefit the patient.
We explained for the patient when came to my office that the pain is not whole of the problem. The pain is only a symptom of your problems.
Well, I think it's of utmost importance, especially in the future when the funds available for treatment will become, relatively speaking, even more scarce as they are today. So third-party payers are already now, and even more so in the future, requesting evidence that what we provide will work.
By being able to show outcomes, we are holding ourselves accountable and saying that when you started, your movement was like this, when you started, your pain was like this, when you started, your trouble in your everyday life was like this, but at the outcome of our treatment session, this is how it's changed. And we can provide like a tangible marker for somebody to look at and say, there is a change in this person, instead of only counting on the patient saying, I feel better.